It has been proved that regular exercise at any age can improve our physical fitness. One of the effects of regular exercise would be improving the cardiorespiratory endurance, which simply means that when you are persistent and following the guideline that I'm going to talk about, you exercise regularly, you end up with physiological changes in your respiratory system and cardiovascular system to improve how efficient these systems are in getting oxygen and nutrients to the tissue cells and removing waste, including carbon dioxide, from the tissue cells. Please note that it's not just about getting oxygen and nutrients to the tissue cells. It is extremely important that we make sure that wastes are removed from the tissue cells. And one of the reasons that when we do aerobic physical activities, it is recommended that at the end, instead of abruptly stopping the activity, we actually go through 3 to 5 minutes of slowing down and then stopping the physical activity, is to make sure that blood flow in and out of those tissues that are highly active during exercise, including the skeletal muscles, would still be high enough to remove the waste from those tissues. Another impact of regular exercise, as we know, would be reducing blood pressure, anxiety and depression, helps us to manage our weight, and it is interesting that the regular exercise also increases the ability of our body to remove and dissolve blood clots. Please note, for a variety of reasons, unwanted blood clots form. But to stay healthy, it is important that those blood clots dissolve before they can cause, for example, blockage in any of our smaller and narrower blood vessels. So these are some of the benefits of regular exercise, and we know that we have a variety of exercises. In this video, mostly the focus is on aerobic exercises. When we say aerobic exercise, we mean those exercises that we use many of our large muscles. And one of the best techniques to be successful in improving activity of many of our systems would be involving in those aerobic exercises that we contract our muscles and move our body against the force of gravity. Obviously, the force of gravity pulls our body down, and we repeat this action. It means that we're contracting our large muscles, again, go against the force of gravity. These are the aerobic exercises that is highly recommended, but it doesn't mean that we are underestimating the benefit of other type of exercises, including weightlifting or stretch exercises that help us to improve our ability to maintain our balance and equilibrium. Public guideline for adults indicates that the amount of aerobic physical activity that an adult should have in a week depends on the intensity of that aerobic physical activity. If you have a moderate intensity physical activity, that would include your walking and your speed is around 3 miles per hour, or if you're bicycling, your speed is around 8 miles per hour. You need to have 150 to 300 minutes of moderate intensity aerobic physical activity in a week. If you are involved in a vigorous intensity physical activity, that would be, for example, you're jogging and your speed is a minimum of 5 miles per hour, or if you're bicycling, your speed is a minimum of 10 miles per hour. If that's the type of aerobic physical activity that you have, 75 to 150 minutes of this type of vigorous intensity activity is recommended per week. And obviously, we can go with a combination of both. Especially if you are new to the world of aerobic physical activity, it is extremely important that you be aware of your maximal heart rate. You just subtract your age in years from 220. For example, if you are 30 years old, your estimated maximal heart rate is around 190 beats per minute. When you start the aerobic physical activity, the best way is time to time taking your pulse, and one of the best places to take your pulse would be in the radial region. Using your index and middle finger, you press above your wrist but medial to the styloid process of your radius, and I recommend that you take your pulse for 30 seconds. Whatever number you count, you need to multiply it by 2. So that would be taking your pulse a few times when you are exercising, simply because in this video I explained that it's dangerous. While physically active, we allow our heart rate to reach the maximal heart rate or exceed the maximal heart rate. Please note, your maximal heart rate depends on many factors, including your overall health. Are you dealing with any medical condition, any systemic disease, or taking any medication? Also, age is a factor. By getting older, the number that we have for our maximal heart rate starts declining. Your physical level, your physical fitness also can impact your maximal heart rate. If the aerobic physical activity is a moderate intensity, when you're taking your pulse while physically active, your heart rate should be 50 to 70% of your maximum heart rate. That simply means if you walk and your speed is around 3 miles per hour, when you're taking your pulse, if your maximum heart rate is 200, your pulse should be between the range of 100 to 140 beats per minute. If your aerobic physical activity is considered vigorous, let's say you're jogging and your speed is above 5 miles per hour, then your heart rate should range between 70 to 85% of your maximum heart rate. It is completely normal that our heart rate goes up when we are exercising, because exercise is a healthy fight or flight situation, and as I explained in the videos, cardiac accelerator nerves and hormones epinephrine and norepinephrine, body in a natural way tries to increase the heart rate so your heart can pump more blood out. However, if we go back and review the 5 major phases of the cardiac cycle, we note that during one of these phases, ventricles pump blood out, and after they pump enough blood out, it's time for ventricles to relax, simply because when ventricles are receiving blood, they must stay relaxed. Now, when the heart rate start getting close to the maximal heart rate, you're demanding the cardiac cycle to be shorter. To shorten the length of the cardiac cycle, at some point, the relaxation period will be eliminated. That simply means when your ventricles contract and push blood out, they try to relax and receive blood, but the next round of contraction starts. So if you imagine your ventricles, every time that your ventricles try to relax and receive blood, next contraction happens, which simply means your ventricles don't have the opportunity to receive blood. And when your ventricles do not receive enough blood, they are not going to pump enough blood out. And now let's quickly think about the design of our body. 2/3 of our life we are in a vertical position. So if you think about the location of the master of our mind, which would be brain, that sits inside cranial cavity, heart has to pump blood against the force of gravity to get blood into the brain. Now that you are physically active and reaching the threshold, which would be the maximal heart rate, because your ventricles don't have the opportunity to relax and receive blood, they're not pumping enough blood out. Brain is one of those many organs that is not receiving enough blood, and at this point, brain tries to solve this problem. From brain's point of view, the problem could be because of the force of gravity. So easily brain change your position and eliminate force of gravity from the equation, simply by changing your position from vertical to horizontal. As you can see, the moment that you faint, force of gravity is eliminated from this equation and you're no longer physically active. So now, finally, brain has the opportunity to receive blood. However, we know the risk of fainting. If you're swimming and you faint, the force of gravity is going to pull you down to the bottom of the swimming pool. If you are running or jogging or having any other type of physical activity and you suddenly faint, clearly there is a possibility of damages to many of our body parts. So that's something that we consider. That's the reason that when we are physically active, especially if we are new to the world of physical activities such as aerobic, we need to pay attention to the signs and symptoms that they are mostly initiated by our brain. If you are physically active and you start being dizzy or feel lightheaded or slightly nauseated, tired, that's a clear message from your brain that you need to slow down, because your systems are not ready for that level of physical activity. So one simple thing would be just slowing down. One of those things that we can pay attention to would be the rate of our breathing. When you start doing physical activities such as aerobic, just pay attention. While doing the aerobic exercise, can you have a conversation or you're going to be out of your breath? If you are out of your breath and you cannot finish the sentences that you're intending to say, that simply means your body is not ready for the intensity of that aerobic physical activity. So you must be realistic and persistent. You need to acknowledge that to make your systems ready for that type of activity, you need to allow them time to adjust, which that means 3 to 5 times per week, at least for 20 minutes continuously. You can start with a moderate intensity, which the simplest one would be walking. Monitor your pulse and also pay attention to your breathing rate. And you see that gradually your systems adjust to this new demand, and then you can increase your pace. You can speed up after a few weeks. We are designed to adjust and respond well to gradual changes much better than rapid changes. I hope that this video clarified how important it is that we find out our estimated maximal heart rate, and how important it is that when we are doing aerobic physical activities, we monitor our heart rate by taking our pulse and make sure that our pulse stays within the recommended range.